Welcome to The Explainer. You know, for anyone who's expecting, hearing the words high blood pressure at a checkup can be really nerve-wracking. But what does that even mean? Well, today we're going to demystify the whole thing and turn that worry into some clear, actionable knowledge.
So, this is really the big question, isn't it? What do those numbers on the blood pressure cuffs actually mean for you and your baby? And what's the real tipping point? When does a little bit of concern turn into something you need to act on? Let's dive in and find out.
All right, here's our game plan. We're going to break it down into 5 key parts. First, the basics of what pregnancy hypertension even is. Then we'll look at the 2 main types, chronic versus gestational. After that, we'll get into preeclampsia and its more serious but thankfully rare complications. And we'll wrap up with the most important part, how it's all managed. Okay, let's start at the very beginning. We need to build a really clear, simple foundation for what we're actually talking about here. The key number to lock into your brain is 140/90. If your blood pressure readings are consistently hitting that number or going above it, that's what doctors call pregnancy hypertension. And you know, it's not just one single thing. It's more like a group of related conditions that doctors watch very closely because they can affect the health of both mom and baby.
So, why all the attention on this? Well, on a global scale, these conditions are a factor in about 14% of maternal deaths. Now, I know that sounds like a really scary statistic, but it's exactly why we need to be talking about it. Because knowing the risk is the very first step in doing something about it.
Look, that number isn't meant to freak you out. It's there to show you why we need to be prepared. It really just highlights why those regular prenatal checkups are so important. Catching high blood pressure early and managing it the right way, those are the absolute best tools for a healthy outcome. Now, it's important to note that not all high blood pressure in pregnancy is created equal. The biggest difference really just comes down to timing, like when did it actually show up? And that's what splits it into 2 main categories. Okay, so check this out. The big dividing line here is the 20-week mark of your pregnancy. If you had high blood pressure before you even got pregnant, or if it pops up in that first half, before 20 weeks, that's considered chronic hypertension. But if it shows up for the very first time after the 20-week mark, we call that gestational hypertension. And notice, for both of these, we're not expecting to see protein in the urine, at least not at first. That little detail is going to become very important in just a minute. And that brings us to the term you've probably heard thrown around, preeclampsia. This is basically what happens when that simple high blood pressure starts to cause more complex problems for the body. Right, so preeclampsia is way more than just a high number on the cuff. It's high blood pressure that shows up after 20 weeks, plus signs that it's starting to affect other organs. That classic sign is protein showing up in your urine. That's what tells doctors that your kidneys are starting to feel the strain. And it can also start to affect your liver or even your brain.
When it's in its mild form, the signs can be super subtle. And honestly, pretty easy to just brush off as normal pregnancy stuff. You know, aside from the BP reading and the protein test, you might just have a nagging little headache, some extra puffiness or swelling, or maybe you gain a few pounds really fast. They might seem like nothing, but these are exactly the kinds of things that you should always mention to your doctor.
But severe preeclampsia, that's a whole different ballgame. These are absolutely not wait-and-see symptoms. If your blood pressure suddenly spikes to 160/110 or even higher, or if you get a really bad headache that just will not go away, any changes in your vision, or a sharp pain high up in your belly, especially on that right side where your liver is, that is your signal to get medical help right away. The whole reason severe preeclampsia is treated with such urgency is to stop it from turning into one of these 2 critical emergencies. They are thankfully rare, but understanding them is the key to understanding why all that monitoring is so strict. Okay. So when severe preeclampsia progresses to the point of causing seizures, that's when the diagnosis changes to eclampsia. And while it sounds absolutely terrifying, it can help to know that it follows a pretty clear clinical pattern. First, the body gets rigid, then come the convulsions, which then slow down and stop, and that leads into a recovery phase. Just understanding that progression can help demystify it a little.
The other critical emergency is something called HELP syndrome. The name itself is actually an acronym for what's going on inside the body. H is for hemolysis, which is the breakdown of red blood cells, the ones that carry oxygen. LE stands for elevated liver enzymes, a sign that the liver is really struggling. And LP is for low platelets, which is super dangerous because it means your blood is losing its ability to clot. This is a true medical emergency that needs immediate expert care.
All right, after talking about all the risks, let's shift gears and focus on the most empowering part, the path to safety. How are these things actually managed? This is where you really become an active partner in your own healthcare.
One of the biggest concerns for any expecting parent is medication safety. And the good news is there are definitely options, like methyldopa and labetalol, that are considered safe for managing blood pressure during pregnancy. At the same time, some really common blood pressure meds, like ACE inhibitors, have to be avoided. The most important thing here is this: medication choices are only made with your doctor. Never, ever try to adjust your own dose.
And, beyond medication, there is so much that's in your hands. Checking your own blood pressure at home gives you and your doctor so much valuable data. Small changes to your diet, some gentle exercise, making rest a priority, it can all make a huge difference. But really, the most important thing is just knowing those warning signs we talked about. That way, you can be your own best advocate. Okay, now here is a fact that catches so many new parents by surprise. The job is not done the second the baby arrives. Your blood pressure can stay high, or in some cases, it can actually spike for the very first time in the days after you've delivered. That's why postpartum care is just as critical as prenatal care. So, what does that postpartum follow-up actually look like? Well, in the hospital, they'll be checking you pretty frequently. Once you go home, you should get your blood pressure checked again within that first week, usually followed by a formal appointment around day 7 to 10. Then everything is usually reevaluated at your big 6-week checkup to see where things stand long term. So if there is just one thing you take away from all of this, let it be this: being informed and being a watchful partner in your own healthcare is the single most powerful tool you have. It's how you take that feeling of anxiety and transform it into focused, effective action. And that leads me to my final question for you. Thinking about everything we've just covered, what is one new question you now feel ready to ask your doctor or your midwife at your very next appointment? Because being an engaged and curious patient, that is your greatest strength. Thanks for joining me on The Explainer.